Hi, this is Dr. Mario Di Pasquale. Thank you for watching us today. Today we're going to talk about the way we do cataract surgery. Now your surgeon told you that you have cataracts and you're ready for surgery. Well, there is different ways that we can do the surgery. We can do it manually, 100% done by your surgeon, or assisted by a laser. Yes, laser. The laser that we use is a laser we call Femto Second Laser. It does cuts on the cornea. That way allowed to make some relaxing incision. That way, if you have astigmatism, it will correct it. And that's the main indication also for the laser when we don't use any premium lenses. When we use a premium lenses, like a toric lens or multifocal lens, this is another good indication for the femto laser. Why? Because we want a precision cut, especially inside the eye. When we do a special cut, we can measure exactly the way the lens that we're gonna implant inside the eye, it stays there in a precise way. We know that as a surgeon, I'm a very proud surgeon to do thousands of cases, but the most important thing is reliability. But we can do it in the same manner again and again and again. And that's what the femto laser technology offered to us, is reliability to perform the surgery in the same manner. And another also good aspect, and that's my personal opinion, we find out in the studies show that the amount of time we spend inside the eye every time we do Femto Second Laser is less, which is for me is a very, very important part, because as a surgeon, we want to spend less time inside the eye, which can generate less inflammation. And of course, maybe that translates into less complication. If you have any question, please do not stop us to contact and reach us, and even making a schedule an appointment with us and to discuss the benefit of having femto laser cataract surgery with us or with any other surgeon. Thank you, and please continue to follow us in the social media.